So hello everyone. Our today's topic is the blood transfusion. So blood transfusion, it is a process in which donated blood components they are given to the patient through a IV line. So the blood transfusion they are done to replace the lost blood, improve the blood count, and provide essential components to patient in need. So first of all, you should know is why the blood transfusion they are important. So in order to treat the blood loss, we give a transfusion to those patients who have lost significant amount of the blood due to surgery, injury, or due to the trauma. Or it can be given. The first is treating blood loss. Second is anemia management. Patient with severe anemia, when there are not enough red blood cells, the patient often require multiple transfusions to boost the red blood cell count. Apart from that, patients who are undergoing cancer treatment or chemotherapy may need blood transfusion to maintain the healthy blood cell level. Apart from that, patients who are chronic ill due to the kidney diseases or sickle cell anemia, they often regular need blood transfusions. Now let us discuss the indication for the blood transfusion. First of all, the indication could be acute hemorrhage. The blood transfusion they are most commonly needed during severe bleeding. So whenever there is a severe bleeding, like the source, it can be either external, that is from a bleeding wound, or it could be due to the internal injury. So can you think of situation where someone might need a blood transfusion due to bleeding? Certain surgeries like the breast removal of the part of the abdomen, rectum, they often results in the significant blood loss. So what do you think surgeries can cause a lot of blood loss? So beside giving the fluids and plasma, blood transfusion they are necessary in the deep burn cases due to the destruction of the red blood cells. So what happens to the red blood cells in case of deep burns? So before surgery, if patient is anemic, that is he having a low blood count and there is no time for iron treatment, blood transfusion, they may be compulsory in that case. So what important is we have to treat the anemia before doing the surgery. So patients who are chronic anemic, long term with a long term low blood count, especially when the hemoglobin is below 10 gram, blood transfusion it helps to treat the anemia. So blood transfusion they are necessary for patients who are severe anemic with severe malnutrition, with coagulation disorders like the hemophilia, Christmas disease, and blood disorders like leukemia. Blood transfusion may be necessary. So can you name a blood disorder where transfusion they are required? The answer is erythroblastosis fetalis. So for the newborns with this condition that is caused by Rh incompatibility. So these are the indication for the blood transfusion. So remember that a deep burn cases, acute hemorrhage, anemia, coagulation disorder, malnutritional disorders, erythroblastosis fetalis, these all are the example. Now let us discuss so with the patient who are with the blood loss we give is the blood transfusion. So it is before that blood transfusion, it is important to ensure that the donor is healthy and free from transmissible diseases like the hepatitis B or AIDS. So the we can do is the blood test performing before or health screening can be done. Now we have to prepare the donor. The donor it lies comfortably on the bed. A sphygmanometer that is uh, a cuff is placed on the donor's upper arm and inflated to make the veins more prominent and easy to assess. So you can give is the local anesthesia is injected into arm to minimize the discomfort. So a needle that is inserted into the median cubital vein. That is the large vein in the arm. So if you are giving a blood donor, then around 400 ml of the blood it can be collected during one session. So how you can, after the blood collection, the storage form is important. So it can be either stored in CPD blood. So the most common type of transfused blood, which is the stored in the blood bank. So remember that it is preserved using a solution that contains citrate, phosphate, and the third is the dextrose. So citrate, phosphate, and dextrose, CPD, to maintain its shelf life. Apart from that, warm blood can be the blood that is formed before the transfusion, particularly used during the CPR operation in order to reduce the risk of cardiac arrest that can be triggered by the infusion of the cold blood. Apart from that, filtered blood, the blood that has been filtered to remove the leukocytes, aggregates, etc. So it helps to reduce the risk of reaction, and also it removes the unwanted components in the blood. Auto-transfusion, the patient's own blood is collected, filtered, and retransfused. Or exchange transfusion can be done. The patient blood is gradually removed and replaced with the donor blood. So it is done in case of the newborns who are born with the erythroblastoma fetalis, or in case of carbon monoxide poisoning, to quickly replace the toxic or incompatible blood with the healthy blood. Now, why it is important to screen donors for the transmissible diseases before the blood donation? To ensure the safety of the blood supply and prevent the transmission of the diseases to the recipient. That is why the screening test, it is compulsory. What is the purpose of using an anticoagulant solution in the blood coagulation bag? In order to prevent the blood from clotting, we use an anticoagulant. And in what situation we use warm blood instead of the stored CPD blood? In case of CPR, in order to reduce the risk of cardiac arrest due to the infusion of the cold blood. So what are the additional component of the blood transfusions one can use is the packed red cells. These are the red blood cells that have been separated from the whole blood with most of the plasma removed. So they are used in chronic anemias, elderly patient, or the children. Or one we can use is the plasma and the platelet rich plasma. So plasma, we know it's a liquid part of the blood that carries the cells and proteins throughout the body. The platelet rich plasma, it contains high concentration of platelets that are essential for the clotting, and it is used in patients who have a low platelet count or those undergoing the surgery. Now remember that what is the storage temperature for the blood? It's 4 degree Celsius. So blood is stored at this temperature to prevent infection and maintain its usefulness. Apart from that, remember that the blood, it loses its ability to carry oxygen effectively within how many days? Within 7 days. So in case of massive transfusions, you prefer fresh blood. Remember, the CPD stored blood, it has a shelf life about 3 weeks. So CPD we already discussed that CPD is C for citrate, P phosphate, D dextrose, and it is a solution that will preserve the blood by preventing clotting and providing energy to the red blood cells. Apart from that, CPDI stored blood that lasts up to 5 weeks. Now, why is the blood stored at 4 degrees Celsius? To prevent the infection and maintain its usefulness. So, why are the packed red cells? They are used for the elderly patients and children in order to avoid the risk of fluid overload and heart stain while providing necessary red blood cells. Other question is, why is fresh blood preferred for massive transfusion? We know that the blood, it loses its oxygen carrying capacity within how many days? It's the 7 days. So making the fresh blood more effective in that case. Now remember this about the red blood cells. These are the group A, they have antigen on their surface. So here the group A, the red blood cells, they have A antigen on their surface. The group B, they will have B antigen on their surface, and group AB will have AB antigen on their surfaces. And group O, here the red blood cells will have no A and no B antigens on their surface. The group A would have anti-B antibodies. The group B blood will have anti-A antibodies, and group AB will have no anti-A or anti-B antibodies, and group O will have, it contains both anti-A and anti-B antibodies. And what are the antigens in the red blood cells? Group A has presence of A antigen, B has B antigen, group AB presence of both A and B antigen, whereas group B has no or B antigens. So let us discuss about the blood group A. So a patient with blood group A would have A antigen on its surface. The red blood cells would have A antigen, whereas the plasma antibodies, it would contain is anti-B antibodies that will attack the red blood cells with the B antigen. So it can receive the blood from group A and O, and not from B or AB. Now remember that the patient who have blood group B, they have B antigen on their surface. So they can receive, remember they can receive blood from the patient with subgroup B, they can receive the blood from group B and group O, and not from A or AB. Remember, blood group O is known as universal donor. That means they can donate blood to any group, that is A, B, or O group. So why is group O considered as the universal donor? So O group has no A or B agglutination on the surface of their RBC. So when blood group O, it is transfused to individual of any other blood group, that is AB or O, there are no foreign antigens on it. So that could trigger an immune response. Since the group O RBC lack these agglutinogens, these are less likely to be attached by the recipient immune system. So that makes the blood group O particularly useful in emergency situation where the recipient blood group type is unknown or when the compatible blood is not available. Now let us discuss the agglutination and hemolysis in the blood. So first of all, you should know that agglutinins, they are the antibodies that are found in the recipient plasma and they bind to the specific antigen, whereas agglutinogens, they are the antigen that are located on the surface of the donor red blood cells and they are targeted for the recipient agglutinin. So agglutination reaction that occurs when the antibodies in the recipient serum, they bind to the antigens that are the agglutinogens on the donor RBC. So this binding that would cause the RBC to clump together. So this clumping you can see it under the microscope, and it can be sign of incompatibility between the donor blood and the recipient blood. Now hemolysis is the destruction of or the lysis of RBC. It can be triggered by agglutination reaction. When the RBC clumps together due to agglutination, it can lead to rupture of the cells. So the rupture cell, they will release hemoglobin and other cellular component that would be released in the main bloodstream that would cause the complication. So due to this hemolysis, there would be reduced in oxygen carrying capacity, and that would affect the free hemoglobin that would be present in the blood. So you should know that when the blood it is transfused completely between the two donors and recipient, blood type must be ensured to prevent the agglutination and the hemolysis. So there could be incompatible blood transfusion that could be due to the recipient agglutinins or due to the donor agglutinogens or these binding that can even block small blood vessels and interfere with the blood flow. Suppose a person with type A blood group having A antigen on RBC and anti-B antibodies in the serum. He receive a B type blood group having a B antigens Now the anti-B antibodies in the recipient will bind to the B antigen on the donor RBC. So that would cause clumping to occur. So that clumping could lead to rupture of the donor RBC, releasing hemoglobin and cause potential complication like kidney failure, jaundice and severe anemia. So when a blood with the incompatible blood type it is transfused into the recipient, it can lead to transfusion reaction. So if the donor blood it contains antigen that the recipient immune system recognizes it as a foreign body, that occurs due to mismatch in blood types. So the recipient immune system that will produce the antibodies against these antigens. So when the Incompatible blood is transfused, these antibodies in the recipient serum immediately recognize and binds to the antigen on the donor RBC. So that will trigger the clumping reaction and the subsequent hemolysis of RBC that would occur. So severity of reaction could be immediate, that occurs within few minutes to hours after the transfusion, and it could be delayed, that occurs hours to days later with symptoms like fever, jaundice or kidney failure that could be seen. So cross matching is important. It involves the mixing of small sample of the recipient serum with the donor RBC, and you have to check for the agglutination reaction before fully transfusion. Other important factor is, remember, it's the RH factor. So remember, RH factor, it's an antigen that is found on the surface of red blood cells, and individual can either be RH positive or RH negative, that is lacking the RH negative antigen. So if the RH positive blood, it is transfused into RH negative person, the recipient may recognize the RH antigen it as a foreign antibody, as a foreign and develop anti-RH antibodies. Now these antibodies, these can cause again severe reaction if the recipient it receives RH positive blood again in the future. That would lead to hemolysis and destruction of the RBC. So incompatible blood transfusion can lead to acute hemolytic reaction where RBC they are destroyed, releasing the hemoglobin in the bloodstream. That can cause acute renal failure, shock and even death. So why it is important to check the RH factor before blood transfusion? To avoid the risk for developing anti-RH antibodies into the RH negative recipient that can lead to severe transfusion reaction. So cross matching is important. What is purpose of this cross matching blood before a transfusion? In order to ensure compatibility between the donor blood and the recipient serum, thereby preventing the adverse reaction like the hemolysis. So what could be the clinical features of this? The patient may have rigor, fever, headache, nausea, vomiting, reduced urine output. There maybe you may see hemoglobin in the urine, that is hemoglobinuria. The patient may present with the jaundice. There could be potential for the kidney failure. The treatment is you have to immediate cessation of the transfusion. You can do is the lab test, take out the urine sample. You can intravenous, you can flush out the toxins. You can do alkalinization of the blood with the sodium lactate and the bicarbonate. Apart from that, diuretics can be given that could promote the urine production. Antihistamine and steroids that could be given. So what are the first signs of incompatible blood transfusion? There would be fever, pyrogens could be seen. Now let us discuss the various products. The first is the plasma. Plasma, we know it's a clear component of the blood that is separated from the packed red blood from the back red cells by centrifugation. Other is fresh frozen plasma. So it is the plasma that is removed from the fresh blood and it is stored at minus 20 degrees Celsius. It can be used in treatment of various coagulation disorders, hemophilia, liver diseases, Christmas disease, vitamin K deficiency. Other is platelet-rich plasma. So when centrifugation is done of the fresh whole blood, we collect the platelet-rich plasma, and it can be given. It is used in thrombocytopenic purpura. Now, how is the fresh frozen plasma prepared and what are its uses? Remember, it is prepared from the centrifugation of the plasma rich from the platelet-rich plasma, and it remains active for 48 hours. Other component that we can use is fibrinogen. It is made from plasma via the organic liquid fractions, and it is used in case of treatment of DIC, that is disseminated intravascular coagulation. Other we can use is cryoprecipitate, and it is formed by thawing the frozen plasma at 4 degrees Celsius, and it is stored at minus 40 degrees Celsius. And remember, it is rich in factor 8 and fibrinogen. So it is ideal for treatment of hemophilia and hypofibrinogenemia. Apart from that, there are synthetic prepared solutions that can be dextran, and it's a plasma volume expander. Other solution is gelatin, and it is less effective plasma volume expander than the dextran. Other is the hydroxyethyl starch. It is made by treating starch with sodium hydroxide and ethylene oxide. Again, it's a plasma volume expander. So what are the guidelines for transfusion? Remember that if there is more than 20% of the blood loss, that indicate the need of blood transfusion. If HB is, then there is general threshold for transfusion, and if it's the HB is in patients with the cardiovascular diseases, more conservative threshold is required for patient with a heart condition. So remember that we can give is blood products that we can give is packed RBC. Remember, 1 unit, it will raise the HB by 1 gram per deciliter, and hematocrit raise would be 3%. Apart from that, we can give is the platelets, that increases the platelet count. Fresh frozen plasma can be given. They provide the clotting factor, and each factor that you increases raises the INR. The cryoprecipitate, it's rich in fibrinogen, and it can be used in patients who are deficient with the fibrinogen deficiency. Now, what are the complications of the blood transfusion that can occur is hemolytic reaction, non-hemolytic reaction, allergic reaction can occur, or transfusion related acute lung injury that can see. Apart from that, there could be infection complication like diseases like hepatitis, HIV, malaria can be transmitted by transfusion, or there could be massive transfusion complication that could be citric toxicity, hypocalcemia, thrombocytopenia, etc. So what are the primary component of the blood? They are the whole blood, fresh frozen plasma, platelets, cryoprecipitate, remember that. So when is the transfusion of platelet rich blood is indicated? In case of acute blood loss, severe anemia, chronic conditions like malignancy, nutritional deficiency. So why might whole blood transfusion be preferred in massive trauma cases as it replaces all component simultaneously, which matches the loss during the trauma.